Welcome to Healthy Corner with Melissa Roches, where we discuss a healthy lifestyle through exercise, a healthy lifestyle through diet, through meditation and wellness. Healthy Corner.
Good morning, everyone. Good morning, Buiti Binafi. To all of our Garifuna people around the world, in the diaspora. Thank you for joining today's show. Today's topic is a continuation of the part one of our series on prostate enlargement. I think this is a very important topic for men to be aware of. Also, a lot of the men in our communities and also in the Caribbean may not or do not have access to the level of care that is provided here or offered or available here in the U.S. So I think it's important to share the knowledge that we know about prostate health so that the men in our communities can learn, one, about the male anatomy and how to take care of their prostate, which is a very important part of who they are. I just think that it's unfortunate that the Ministry of Health, if this information is not being shared, that it's, this can become very detrimental to the men in our communities. I included a presentation that we watched, I think like the first 5 minutes of a presentation by Master Herbalist Patrick Delves. And he mentioned in that video, and we'll go through it again in its entirety, he mentioned that Caribbean men, and I don't know how true the statistics are, but in his video, he said that men in the Caribbean are not living past their 50s, or their 51 or 52, I believe is the number that he mentioned. So it's vital that we support the men in our communities, that we share the knowledge that we know, and even your experience. There's nothing to be ashamed of. We all have ailments and issues, and let's admit it. There's a lot of issues here in the U.S. in terms of our diet and nutrition, and it's the same in the Caribbean because we're still eating the same food over and over and over again. So it's important that we change our diet, change our nutrition, start eating anti-inflammatory foods that are available to us in our markets, and cut out sugar, dairy, processed food, the seed oils, canola oil, vegetable oils. Those oils are very, 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 very inflammatory. And they're one of the causes of a lot of the issues that we're facing, not just prostate, but also diabetes, high blood pressure, because those oils are so inflammatory, they can potentially clog up your arteries, cause your cholesterol to increase, and all of those contribute to heart health, right? So you all know that I advocate for removing all of those oils out of your home and use either hemp oil, walnut oil, or avocado oil. Those are the healthier oils that have anti-inflammatory properties that can that your body will be able to absorb better and digest without causing, a lot of inflammation in the body that causes the dis-ease that we face. All right, so we're going to finish our series on prostate health. So we're going to do a quick recap on what the prostate is with the male anatomy, the increase that doctors are seeing for African American and Caribbean men in terms of prostate health. We are also going to talk about the lymphatic system, how the lymphatic system is connected to prostate, enlarged prostate, and movement and exercises that you can do to help reduce enlarged prostate through the lymph nodes. Now, you all know that I also advocate for doing the lymphatic massage every day because your body has lymph nodes from your head to your toe. And we'll get into that a little bit with the lymphatic session. We're going to do a recap of the benefits of vitamin D, how critical it is to have vitamin D because low vitamin D level is one of the risk factors for prostate cancer. And we are Dr. Berg is going to talk us through again the root cause, which is a hormonal issue, right? Your testosterone, your estrogen as well. Those are two of the root causes, low estrogen and testosterone. Those are two of the root causes of enlarged prostate, and prostate cancer, and the lymph nodes can actually help with that and some of the dietary changes. And then we're going to jump into a gentleman who will give us those movement in terms of lymph nodes or for the lymphatic system that can help. And then we're going to watch the full presentation from Brother Patrick Delvez on prostate and prostate cancer and what you can do to prevent or reduce your risk of prostate cancer. And then we will end the show. So before we get started, I do want to quickly thank our audience, the Garifuna community, the Belize community all over the world who reached out after my father, Arthur Roches, passed away about 2 weeks ago. I want to sincerely thank you all for your thoughts, your prayers, your stories, for your concerns for my family, friends, extended family of my dad. It's a difficult time, but I can say that, I love my dad. We had a great relationship, and he's in a better place. But it's difficult mourning the loss of both parents. And that's just part of life. Everyone will go through that if you haven't gone through it. And if you have, you understand where I am in terms of my grieving. But my dad was the Ministry of Health. He was appointed Ministry of Health. So I feel like I'm somewhat continuing that mission in my own way, using Healthy Corner as a platform to be able to share my knowledge and the research that I have done to help not just myself, but my family as well, just to educate them and provide information that they need in terms of improving their health and lifestyle so that they can live a longer and more fruitful and better life for their families. So again, I just want to share just a couple pictures. My dad, he was part of the Queens Park Ranger. You guys may know some of these names. I remember Mr. Rabu Garcia, Mr. Garincha. I still know them. Mr. Timo, he was a very good friend of my dad, and I, was fortunate to have met and still know Mr. Garincha to this day. I was fortunate to have met a few of the men that he grew up with, and was part of the Queens Park Ranger, which he was very well known for, being a part of this football team. So, my dad has quite a few kids, but these are just pictures of me and my brother, kids from, what he had with my mom. He loved his white shirt. He loved his white V-neck shirt. And I personally picked that up. I don't like shirts on my neck, like literally on the top of my neck. And I get that from my dad because he loved to wear his V-neck shirts, and so do I. So just wanted to share a couple pictures with our audience to just, again, give you thanks for all of your thoughts and prayers as we, continue to grieve the loss of my dad. So with that, we are going to take a quick commercial break, and we are then we'll jump into our show. Again, quite a bit to cover. But again, this is an important topic, and I will finish this out, and then we'll have a new topic starting next week. So with that, let's go to a quick station identification break, and we will be right back. Camera 4.
This is Gary Vision Indigenous Network. Garifuna Suada.
All right. Okay. We will be right back. I hope you didn't mind seeing my face during the commercial station identification break. Okay. So I do want to preface by saying, again, I want to preface with the disclaimer, which is the content presented has educational and informative is for educational and informative purposes only. It does not replace in-person medical consultation or personal diagnosis, and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. If you have symptoms or doubts about your health, always consult a qualified professional about any questions you may have regarding a medical condition. Always research based on your individual health status and pre-existing condition. Again, we do not offer any medical advice here. The information that's shared is educational purposes only, but we encourage you to, ask questions to your physicians, do your own research, but the information and content that's being provided on the show is being shared from content providers who are also doctors or who have done their own extensive research on these topics, and they share them with their audience. However, our community may not have access to or it's not even a priority for them to be able to follow these doctors and these content creators. So our purpose is strictly to bridge the gap, share these content that is being shared publicly on YouTube, Facebook, Instagram, any social media platform, bring it to our audience so that you become educated on what they are sharing, and then again do your own research. So with that, we're gonna go back to Dr. Sean Nick Raven. He's going to talk to us again about the prostate as part of our recap.
Lovely people, this is Dr. Nick Raven, endocrinology and metabolism. I just saw a patient just before this, and the question was, Dr. Nick Raven, thanks for everything you've done, but can you tell me what the prostate was? And I was like, oh my God, that is such a basic question. I should have educated the patient. This is why we're making this video. The prostate is a male organ. This male organ is responsible for creating seminal fluids. These seminal fluids are responsible for carrying what? Can you guys guess? Yes, sperm. Where is sperm made? Can you guys guess? In the testes. Through the seminiferous tubules, those guys make sperm for us. The sperm that is produced in the testes travels through the appropriate channels into the prostatic region, in which prostate joins this fluid with the seminal fluid during ejaculation. So whenever you ejaculate, The sperm releases the sperm into the prostatic canal, and the sperm gets combined with prostatic seminal fluids. These fluids are then ejaculated out of the urethra into the vagina. So that's the function of the prostate, which is a very important gland. Now, the question I get asked oftenly when we do a sperm analysis, what is the typical pH for the semen? Well, can you guys guess? Is it acidic? Is it basic? Which one is it? Well, the prostate fluid is more basic than the vaginal fluid to neutralize it. Typically, prostate fluid is between 6.4 to a pH of 7, while the vaginal flora is somewhere between 3.8 to 4.5. So the vagina is much more acidic in comparison to the prostate, therefore making prostatic fluid more basic. But in literally, prostate fluid is more acidic than body pH because it's usually less than 7. So when we do a fluid analysis, seminal fluid analysis, prostate analysis, and sperm analysis, we look to see what the pH is because that's exactly how healthy the sperm can actually travel and get the job done and impregnate the patient, the female patient. So that's very, very important. So the prostate gland, besides being a nuisance as you get older, because it typically enlarges the size, obstructing the urinary flow in the bladder, his sole responsibility is to create seminal fluid, the ejaculatory volume that you see after ejaculation, because sperm is usually contained with this to help you impregnate your partner. So I hope that answers your question about the prostate. Besides being a pain in the ass gland as you get older, the main function is a reproductive organ in male, which is very, very important, and a healthy prostate is very, very important. So check your PSAs, check your prostates, talk to your doctor, and I hope that answers your questions. Thank you.
Nick. That was a recap from Dr. Nick. So we're going to go to our second recap, which are pictures about prostate cancer, right? Just quick facts about prostate cancer. So again, African American men are at higher risk of prostate cancer, including men of African Caribbean men of African ancestry. Again, this is just a quick recap from the previous show for anyone that may not have watched the part one. So early symptoms. Again, weak or interrupted urine, difficulty urinating, incomplete bladder emptying, erectile dysfunction. All of these are symptoms of potential prostate cancer. And then again, below you'll see the symptoms of prostate cancer again. So we want to make sure that we are shedding a light on prostate cancer so that the men in our community and in our lives are have the support so that they can reduce their risk of cancer. So the men also take a PSA, as mentioned by Dr. Nick, and there's different levels of PSA, low and Mic check, mic check. Can you hear me? Can you hear me? Can you hear me? Yeah. Okay. Can you hear me? Can you hear me? Okay. Sorry about that. We're having mic issues for a minute. But we just want to make sure that there's a level of awareness about prostate cancer and how the men in our communities are at higher risk. So now we are going to go to a video about what you should know about prostate cancer. Again, this is a recap if you didn't watch the first show. it's important that we reshare this information. So we're gonna go to this video.
The most important thing for Black men and prostate cancer is early detection, because I think what happens is there's this, we find, and it bears out in the literature all the time, that Black men present at a younger age, but with a more advanced stage, a higher PSA. PSA is the marker for prostate cancer than white men. And, if you detect the cancer later in the stage, it's often harder to treat, and the risk of recurrences and metastasis and death and so on are higher. So if we can detect the cancer at a more manageable stage earlier on, and again, this is why the active surveillance thing is such an important issue. Very early prostate cancer, you don't need to treat, but when it's early enough, like an intermediate risk prostate cancer that needs treatment, that's highly curable. So if we could sort of encourage, screening in the populations that are at most risk of dying from prostate cancer, i.e. Black men, then you can hopefully decrease that risk of mortality in the Black population.
And similarly, if you are Black, African American, Caribbean American, you also have on average, higher risk of earlier and higher risk prostate cancer. So you may consider starting screening earlier, such at age 45. It's evolving, so we are learning more and more about this every day with tests that are underway. So there are some genomic markers that are essentially tied to your genes that are different depending on what your ethnic background is. So we have identified some of them. We don't yet know all of them, but these are continuing to emerge in our data repositories, and so part of it is genetics, and we will know more about these in the coming years.
Okay, so that was a quick recap about why African American men and Black men in general are at higher risk of cancer. It's genetics. There are certain markers that they look for. But research continues. So now we are going to go into another important video that was shared about why prostate cancer risks are higher in Black men and some of the symptoms. So we'll go to that video now.
What prostate cancer risk factors are higher in Black Americans than in other groups? A risk factor is anything that increases the risk of getting a disease. Some risk factors like smoking can be changed. Others like age or family history cannot be changed. Having a risk factor does not mean that you will get the disease. It just means that it's more important to get screened for it and catch it early. There are dietary factors. It appears that eating a lot of dairy products appears to create a higher chance of getting prostate cancer. Overweight and obesity are more common in the Black community. Some studies have found that obese men have a higher risk of getting more aggressive cancer and also a greater chance of having it advanced and of dying from prostate cancer. Geography is an issue. Prostate cancer is most common in North America, Northwestern Europe, Australia, and the Caribbean islands. It's less common in Asia, Africa, Central America, and South America. Factors like lifestyle differences like diet are likely to play an important role. Asian Americans have overall a lower risk of prostate cancer than white Americans, but Asians living in America have a higher risk than their counterparts living in Asia. There may be a possible link between exposure to Agent Orange, a chemical that was used as an herbicide in the Vietnam War, and family history. Since more Black men are diagnosed with prostate cancer, a Black man is more likely to have a relative with prostate cancer. And if a father or brother has prostate cancer, this more than doubles the man's risk of developing this disease, especially so if it's a brother. The risk is even higher for a man with more than one affected relative, and it's also higher if the relative developed prostate cancer when they were young. Prostate cancer is rare in men younger than 40, but the chance of developing prostate cancer rises rapidly after age 50. About 6 out of 10 cases of prostate cancer are found in men older than 60. There are gene changes. There are genes that are associated with breast cancer, the BRCA genes, BRCA1, BRCA2, and they have found that while they increase the risk of women having breast and ovarian cancers, they also increase the prostate cancer risk in men. Smoking may lead to a small increase in the risk. There are some chemical exposures. They found that some firefighters have been exposed to chemicals that tend to increase the risk. Some people think that inflammation, like if you have prostatitis, may lead to an increased risk of prostate cancer. Sexually transmitted infections, they may have a questionable role. A very interesting study by Dr. James Bennett, who's a prominent urologist here in Atlanta. He looked at the vitamin D levels of his Black prostate cancer patients and found that they were extremely low or non-existent. African Americans with darker skin need more sun to produce vitamin D, which is the sunshine vitamin, as it's so called. In the winter months in North America, nobody gets enough sunlight to produce good levels of vitamin D. The days are short, the sun is less bright, and we're covered with clothing. So I think the vitamin D levels may play a role in the higher rate of prostate cancer among African American men.
All right, so that was a recap from Dr. Bonhomme. He is located in Atlanta, and he has a full series. If you follow him, his last name is Bonhomme, and he has his own, as you can see, he has his own YouTube page, and he also did a series on prostate health. So there are a lot of factors, especially low vitamin D, because vitamin D helps to reduce the risk of cancer. So we are going to go into a video about vitamin D, what it actually is, which is a hormone, and why it's so important for us to make sure that our vitamin D levels, reach a certain level in order for it to be, I believe the doctor used the word therapeutic. So we're going to go to that video recap, because again, it's not, as Dr. Bonham mentioned, it's not just prostate cancer, it's breast cancer, and also prevention of a lot of diseases, which is why your vitamin D level needs to be at a certain threshold, to try and keep your body functioning optimally and reduce the risk of these kinds of ailments. So we're going to go to that video now.
So vitamin D, when I say D, I mean D3. When the sun hits your hand, it turns a chemical in your skin into vitamin D1. Vitamin D1 travels to your kidneys turn it into vitamin D2. It goes to your liver turns it into vitamin D3, and that's what you use for calcium metabolism. So when you buy a vitamin D2 over the counter, maybe you don't have the enzymes to turn it into D3, and you don't use it as effectively. Right. Does that make sense? So you want to kind of bypass all that by getting vitamin D3. So the reason why the supplement companies dump vitamin D3 in with calcium is because they know people think they should take it. Vitamin D, I'm going to catch up to your question. Let me just backtrack a little bit. Vitamin D is a hormone. It's not a vitamin. It was mislabeled. It's important for calcium metabolism, but it's also anti-neoplastic. Meaning it fights cancer, and if you get your serum level up to a 60. So you need to have your doctor look at your serum level or your blood level of vitamin D, and you want to get it between a 60 and an 80. That is the dose at which vitamin D acts as an anti-neoplastic for all adenocarcinomas. So that's breast, prostate, lung, for example, pancreatic. This data is very, very important. In fact, people with low vitamin D are at risk for getting prostate cancer and at risk for progression. So vitamin D is a critical therapeutic for you. The question is, how do I know how much to take, right? Because if you take too much of a hormone like vitamin D, you can cause heart issues, like a heart attack. So that's why when they give it to you over the counter in these formulas, the supplement companies know that you want it, so they put a very small dose. The vitamin D that you're taking in these formulas or that you see over the counter is usually low dose. It'll be between 400 or 2,000 over the counter. That doesn't do anything to help you. You do need to take more than 2,000 to reach that therapeutic level. Does that make sense? But it's hard to, 4,000 is good, but it depends on what your serum level is. Get the blood test done, find out what your serum level is, and you dose to that serum level. If you stay at 2,000, it'll maintain where you're at. So it has to be above 2,000, but you don't want to go too high and risk a heart attack. Vitamin D, it doesn't matter what brand you get. So it's safe to take over the counter, but the over the counter doses are very low. So you'd have to take a ton of it to get to that therapeutic level. There's a study that just came out that if your serum level is over 70, there's some people who are having balance issues, which puts them at risk for fractures. This is why it's so important to see someone like myself who can titrate it to you as an individual. Not everybody's at fracture risk. Age matters. What you're eating matters. What other things you're taking matters. Have you had pelvic radiation? That matters. You know, are you at risk for falls for other reasons? For example, neurological issues, diabetes, peripheral neuropathies. So all of those things come into play. It's not so simple, you know, Glenn, as taking the handful, the mitt that you do in the morning. Although I'm happy that you're taking care of yourself, I think that's the risk, is that you think, well, I'm doing the right thing, right? You know what I mean? And I want to make sure, and we want to make sure, MIU and myself, that you're taking the things that are really going to benefit you.
All right, so that was Dr. Sheba Roy, you know, just doing a little deeper dive into the importance of vitamin D. Again, there are a lot of factors involved, including any current ailments like diabetes, as she mentioned. So if you are fortunate to see a doctor, please make sure that you get your vitamin D level checked. Just as part of, you know, get that natural vitamin D1 that she mentioned into your skin. It's absorbed from the sun. I think actually the ultraviolet ray. Us as African Americans, most from my research and what I have also heard from doctors that I follow, is that we are the most deficient population in vitamin D. So please make sure you're getting checked. Make sure you're getting enough exposure to the sun. Get sunlight first thing in the morning. Get sunlight as much as possible. Take the hat off. Take the sunglasses off. Just get a little bit exposure in terms of the sun for that D1 to D2. And then, as Dr. Roy mentioned, that gets converted in your liver. So again, I did a segment on liver. Liver health is very important. You know, it's another topic that I will revisit, but it's important that you keep your liver healthy. All right. We're going to go now to the root cause, some dietary changes that you can make. But let's talk about the root cause of enlarged prostate.
Prostatic hyperplasia. What does hyperplasia mean? It means enlargement. Okay, so this BPH problem is basically an enlarged prostate. It affects your urination. The stream of your urine is a bit on the weak side. You might find that you dribble after you urinate, and you just might have the sensation that your bladder is not empty. So we're going to talk about this, and there's actually this one drink that you can consume every day to help you shrink the prostate. But more important than the remedy is to understand the mechanism and how you develop this problem in the first place. A lot of men, as they get older, develop this condition, and some even develop prostate cancer. So this video is going to cover both topics. So basically, you have this prostate that is just underneath your urinary bladder, and there's a little tube that comes out of the urinary bladder. Okay, that's called the urethra, and the prostate wraps around that. And normally it should be small, but when it enlarges, it becomes bigger, and it can constrict the little tube that allows urine to flow, and even become so big it can push up into the urinary bladder, decreasing the volume of your urinary bladder, so you really don't have the full capacity to hold urine. All of the estrogen that women have and that men have actually originate from testosterone. So estrogen is a byproduct of testosterone. And to convert testosterone to estrogen, you need this enzyme called aromatase. And aromatase is made by the testicle as well as your fat cells. So that's number one of this foundation. Number two, excess estrogen increases the size of the prostate. That's interesting because you probably thought that your problem was too much testosterone. But if that's true, then why does testosterone decrease with age? In men, estrogen increases with age. And like I said before, estrogen is an anabolic hormone. It makes things get bigger. Here's another little thing. Intraprostatic estrogen levels, that means the estrogen within the prostate, is not dependent on the estrogen in the blood. So you can't really figure out how much estrogen you have in the prostate by measuring the levels in your blood. Estrogen also increases another hormone called prolactin that can also increase the size of the prostate. Phytoestrogens, certain phytochemicals in plants, can mimic estrogen, but not very strongly. In fact, very weakly. So if we look at human estrogen compared to plant estrogen is basically about 10,000 to 140,000 times less strong. So this is why sometimes people are confused when they're eating certain plants and herbs that might increase estrogen. It's a very, very, very tiny amount. And so you're never going to have to worry about becoming estrogen dominant if you consume any of these plant-based estrogen compounds. And I'm really talking about the phytoestrogens in pumpkin seeds and saw palmetto, and even certain types of soy. Of course, if you're going to do soy, you have to really make sure it's always organic because most of the soy is GMO. But the remedy that I'm going to recommend for the prostate is not any one of those. What I'm going to recommend is we focus on inhibiting that enzyme that I mentioned. Remember we talked about testosterone turning into estrogen, okay, with help of that enzyme called aromatase. What we want to do is we want to inhibit that enzyme naturally. If you can inhibit that enzyme, you'll have less production of estrogen and hopefully you can shrink the prostate. Now, the first thing to know is how does this enzyme increase? Okay, because it does increase with age, unfortunately. And also it can increase with body fat. This is why losing weight is an important thing. It can increase with insulin. I've talked a lot about that topic. In fact, if you're on keto, you're going to be a lot better off because you're then going to decrease that enzyme directly by reducing insulin. This is why even diabetics or people that do high carb diets have a big problem with the prostate. Now, another thing that increases this enzyme, alcohol. I'm sorry, it does. Alcohol is definitely a factor. It can actually just make more estrogen in your body. Another one is whole grains, so-called healthy foods that they say you should be consuming. And then you also have hormone replacement therapy or birth control pills, which you just need to know that like estrogen can also increase that enzyme. What will decrease that enzyme? This is the most important thing you need to know from this whole video. Number one, regular consumption of cruciferous vegetables like kale, broccoli, cabbage, arugula. All of the cruciferous have the capacity of decreasing that enzyme, helping you regulate this extra bit of estrogen that you have. Another thing that will help you is white button mushrooms. Make sure you saute them, don't eat them raw because you don't get the effect if you have it raw. Flaxseed, which I know some people are concerned is going to increase your estrogen. It's not going to, but if you've heard conflicting information, you have two choices. You can actually read the studies down below or just omit that remedy altogether because it's not the most powerful one. Another remedy would be green tea, but the biggest remedy I'm going to recommend, okay, and I'm going to put the links down below, is citrus peel, okay, the peelings of lemon. Apparently there is some really interesting things in lemon peel that not only inhibit that enzyme aromatase, but will perform all sorts of other benefits for not just the prostate, but for the whole body. There's actually 5 times more nutrition in that peel than the actual juice. So in addition to losing weight with healthy keto, reducing the insulin, consuming cruciferous vegetables, what you need to do, you can do this at any time of the day, take a whole lemon, okay, put it in the blender with a glass of water, okay, and then blend it, make it all nice and creamy, maybe blend it for 30 seconds. And you can also then add about 5 to 10 drops of liquid stevia, okay, to sweeten it. Or you can add 1/2 to 1 cup of blueberries, which also support the prostate as well. You can blend all that together and drink it as a shake, either with or without the blueberries. The lemon peel is the most important because we're trying to reduce that aromatase so we can reduce the estrogen and keep these ratios of higher testosterone or normal testosterone to lower estrogen. So out of anything you can do, those are the most important steps. Now, there's some other really cool benefits with lemon peels that if you haven't seen this video, you must watch it. I put it up right here.
All right. So now I hope we understand the root cause of some of the root causes of enlarged prostate and what you need to do to reduce your prostate. So what is that? Again, it's estrogen and testosterone, which all men and women have. In women who are going through perimenopause, we're going through the same thing that you men are going through in terms of enlarged prostate, but you know, in a different way. We do face estrogen dominance, and estrogen is actually stored in your liver. So it's important, as I mentioned before, make sure that you keep your liver healthy, so that you can also help to reduce that estrogen dominance that was mentioned by Dr. Berg. The lemon peel and water. I haven't tried it, but I'm going to give it a try since that helps with the estrogen. And again, women face that issue as well. But, you know, just a word of caution, because a lot of the food that we purchase has been grown. Consider trying that. I'm just putting that out there. But again, it said, Dr. Berg mentioned it raising aromatase is the root cause. And what raises that aromatase? Body fat, insulin, high carb diet, alcohol, whole grains, hormone replacement therapy, which a lot of women turn to help alleviate a lot of the symptoms during perimenopause. So I didn't say it, the doctor did. So the other things that raise it, insulin, obviously that's linked to diabetes, high carb also linked to diabetes, high cholesterol, all of these diseases, unfortunately, and these issues with enlarged prostate seem to have the same thing in common, which is our diet. So lower aromatase, cruciferous vegetables, mushrooms, flaxseed, green tea, and the citrus peel. So we eat vegetables, green vegetables here every week. Now our diet in this house is 85% of the time we eat healthy. The other 15 is if we feel like eating rice and beans, chicken and salad. If we go out to a restaurant, but we're cautious about what we order from the menu. Make sure it's loaded with vegetables and less carbs. So just things that you can, still consider if when you go out to eat. Flaxseed, I sprinkle ground flaxseed on everything that we eat. I make my own version of green tea. But there's things that you can do with the green peel and also eating blueberries every day that will help. All right. So we're going to go to a commercial break, and then we're going to come back with the second part about the lymphatic system. I've talked about the lymphatic system so much because it is literally going to change your life if you do it 2-3 times a day. Do the lymphatic massages, but there's a link between your lymph nodes being stagnant and the and enlarged prostate. So there are movements that you can do every single day, 2-3 times a day. I do it 2-3 times a day to help with congestion because it's part of our immune system. So we'll talk about the lymphatic system, and then again, anti-inflammatory foods, and then Patrick Delvey's presentation on prostate cancer. So I hope you all stay until the end because, again, this is important for the men in our lives and in our community. So let's take this 1-minute break, and we'll be right back. Welcome back to Healthy Corner. All right, so we're going to jump right in, dive right in, and we are going to share a couple clips about the lymphatic system, which is very, very important to understand because it's how our body gets rid of waste, toxins, foreign foreign items in our body, because everything we touch, unfortunately, may have toxicity on it. So it's important that we're taking care of our lymphatic system, flushing with water and some other things that's available to help keep the lymphatic system healthy. So let's go to the
system,
first
which is
video.
a part of your immune system, has many functions. They include protecting your body from illness-causing invaders, maintaining body fluid levels, absorbing digestive tract fats, and by removing cellular waste. So blockages and diseases or infections can impact your lymphatic system function. So right after your skin and mucous membranes, they're the white blood cells that help protect your body. They target viruses, bacteria, parasites, yeast, fungus, molds, toxins, and damaged cells. And when they find them, they literally take them to jail, and that's your lymphatic system. So to improve your lymphatic system health, you reduce poisons like stress, preservatives, and sugar. Number 2, you have movement, which makes your lymphatic system drain and helps to get the toxins out of the system. And then changing the hydrogen ion content of the lymph nodes with the right balance of potassium and hydrochloric acid. This helps the body's lymphatic system, which will help you to be healthier.
As mentioned in the video by, I believe, Dr. Greg, your lymphatic system gets rid of waste and toxins. So if you are not hydrated, if you are not drinking fluids throughout the day to push those toxins out, your system will become stagnant, and that'll start affecting your immune system. So whenever you feel like you have a cold, a flu, even headache, it's your lymphatic system just being stagnant because it hasn't been able to push those toxins out, and then that goes through your liver and your kidney. So make sure you are staying hydrated. One of the easiest way to drink potassium is mentioned that he mentioned is potassium. Potassium actually helps you to flush. It helps to move. So coconut water, if you're from the Caribbean, you know coconut water, drink coconut water. You can dilute it with regular water, drink coconut water, add a little bit of lime and maybe even a pinch of sea salt. And that's your electrolyte, and that will help you to flush. If you just drink one of those small little small coconut water bottle packets thingies, you're gonna go to the bathroom like within minutes, and that's your system, your lymphatic system, doing what it's supposed to do. I always advocate doing the lymphatic massages, right? Because your body does not have a pump. Actually, the only pump your body has is your heart. But you need to be your body's own pump, and that's what the lymphatic massages are for. Is so you can move your lymph, right? So again, the fluid drains here in your termini at the top of your neck. So, gentle, you need to be gentle. So the right side drains less fluid than the left side from what I have learned. So it's important that you keep fluid constantly moving throughout your body. And the way you do that is hydration. Do the manual lymphatic drainage massages called MLD, which is this. So you start here at your termini. You can massage your neck, the armpits, again, up and away, 20 to 30 times, up and away. Again, your neck, right here below your ears. Massage your ears as well. And if you find yourself yawning or taking a deep breath, that's actually good. Your nose drain. It'll help to drain the mucus from your nose. Your forehead, because again, you have these little nodes, literally from your head to your toe. So I do this 2-3 times a day. Before I go to bed, when I'm in the shower, maybe two more times at work when I'm at work. Also, gently massage your chest. Your between your belly button and the top of your rib cage is called the cisterna chyli, and that's where the fluid actually goes back up through your heart to your neck. So make sure that you are rubbing, and this is also good because it will help with your digestion. So please make sure that you are you're doing these massages daily. Also do diaphragmatic exercises, which is take a deep breath, your belly will expand and it will return back to its normal state. And that's because there are other lymph nodes that you just can't reach by rubbing. So the diaphragmatic breathing help, and it's also very good to bring your cortisol level down. And then for men with prostate health, and you'll see in an upcoming video, and this goes for everyone, is you want to get the groin area. So massage the groin area up, because the fluid goes up, remember, all the way up to your neck. So you want to massage this area 20 to 30 times, maybe 2-3 times a day, for women and men for your prostate health. And then last but not least is behind the knee. So if you press behind your knee, there's a soft spot there. That's your pump. All right, just like your armpit is your pump, your chest massaging, your cisterna chyli, that soft spot under your knee is your pump. And that's what sends the fluid from your toe all the way back up through your cisterna chyli to your neck. So that's how your body is supposed to circulate every single day. So make sure you're doing this 2-3 times a day, and it'll help with any kind of ailments, diseases. Lymphatic drainage is also recommended, from my understanding, for anyone that has had surgery, because you got to get the lymph nodes moving again, because that's your immune system, or else again you can it can affect your health. All right, so we're gonna go to Dr. Opinski. He talks about the lymph man shuffle, so that's one of the lymphatic movements that you can do. So let's go to Dr. Lipinski.
If you are going through cancer treatments now, or maybe you're a cancer survivor, what are you doing to improve healing and to prevent a recurrence later? What you have to do is reduce inflammation. Many people after their cancer treatments think they're done. That's when you have to change your cellular environment to prevent a recurrence, get rid of that inflammation. We have to get the lymphatic system flowing. We all have a network of vessels and nodes that must flow up to the major lymph vessels in our neck. If you have pelvic cancer, abdominal cancer, or breast cancer, is the lymph system able to flow and clear cellular waste that is probably creating your cancer and damage to your cells? So it's really about opening up the major lymph vessels in your neck. We do it with the lymph man shoulder shuffle. And of course, you have to know to eat a greener diet, take magnesium to improve lymph flow and relax the body, do some exercise and drink water. But opening up your lymphatic system can make you have more energy, more alive. So we put one shoulder up, one shoulder down, and we do that nice and easy if you have any pain. But if you don't have any pain, do it a little faster, 20 or 30 times, 2 or 3 times a day. And make sure you check out my profile and link tree for more information that'll really change your life. You should feel flow through your body. And that's how our cells recuperate, by bringing them oxygen, nutrition, and getting rid of their waste. So the Lymph Man Shoulder Shuffle can really help you recuperate during your cancer treatments and help you avoid a recurrence later.
Dr. Opinski, do the Lymph Man Shuffle. All right, we've done these as dance moves in the past, but you were actually helping your lymphatic system. And I do this several times a day. I do this throughout the day. When I'm in the car dancing, I'm doing the Lymph Man Shuffle to get that lymph moving. Francois is doing it right now in the control room. So we do the Lymph Man Shuffle. We have the vibration plate that we also use for the lymph. He also mentioned magnesium, which I've mentioned on this show before, dietary changes, exercise, and water, drinking water. But I suggest add in coconut water to your water, just to get some added nutrients from the potassium. I find Lymph Man Shuffle also very good for breast health. So women, I highly recommend doing this for breast health as well. So just do it whenever. If people think you're crazy, let them think you're crazy, because you're actually doing something that's healthy for your body. You're keeping your immune system strong. You're preventing, diseases and any kinds of colds, flus. And it helps, as he said, as part of, after cancer or post-cancer tool or activity that's recommended to get the lymph flowing again. All right, we're going to go to the next video. This video is from a gentleman. He goes by Prostate God, and he has talked about his experience with enlarged prostate. He's on YouTube. He did a 2-part series, I believe, on prostate and the lymphatic system. So he's going to talk to us about some of the similar lymphatic movements, and diet as well, and he's gonna give us a little recap on the lymphatic system.
Yep. Welcome back, brothers, to part 2 of a series, the lymphatic system, and how it is the unsung hero of your prostate gland. It drains toxins, reduces inflammation, and just dries out the fluid. Excess fluid around the prostate helps the prostate get rid of toxins. So stagnant lymph system leads to swelling and congestion, overall dysfunction. So today I'm going to give you the blueprint, exactly what I do, what you need to do. Get that lymph flowing freely so that your prostate has a more toxin-free environment in which to live in. Okay? So your lymphatic system doesn't have a pump, right? It doesn't have a pump like your heart does. So how does it flow around the body? Well, that flow is dependent upon you making it flow, your movement, your breathing, your hydration. All right? Let me give you the solutions. The first solutions will be physical. So movement is medicine for your lymph and for your prostate. This is what you got to do daily. Alternate shoulder shuffle. Stand up tall, arms dangle. And you're just going to do this. Right? It shakes up stagnant, shakes that stagnant lymph loose. You do this about, 3, 4, 5 minutes until you get tired. Then you're going to do lymphatic tapping. You're going to tap right here, just below the shoulder, in the crease, in the clavicle, where that bone is at. Right where your collarbone is at. You just tap there. This is some areas where lymph drains back into your bloodstream. All right? Your lymph drains into your bloodstream, but it activates the flow. Then you're going to come under here, pat under your arms. You do this for a few minutes each. You pat under your armpits. There's clusters of nodes up in there, right? And they filter the upper body lymph. And you can pat along the inside of your thighs too, where the crease is. You can rub those. Get out of the shower, put a little lotion, because it's very sensitive skin, very thin skin there. Okay, so you rub, you tap, hands on hips, and do some shoulder, trunk twists. Twist, right? Gotta open up that whole area inside, lymph, get it all activated. And brisk walking, we talk about that 15, 20 minutes. You can do some rebounding on your toes, very lightly, all right? You're not jumping up and down, just lightly on your toes. Just lightly, 2, 3, 4 minutes. And you breathe with that, right? Breathe with that. Especially with the bouncing, with rebounding. Your diaphragm is like a pump for your lymph. So you do that rebounding for like 5 minutes, twice a day. Do it in the morning, Inhaling through your nose. Feel your ribs expand. Okay? So make sure you do that in conjunction with your breathing. And then you do the massage in the crease where if you're wearing tight underwear, you massage that crease. All right? So your lymph is mostly water, right? So if you're dehydrated, it gets sluggish and thick. So you want to drink at least half your body weight in ounces of spring water daily. Occasionally throw some good salt in there. And sip it throughout the day. Don't try to guzzle it. Sip it throughout the day. Right? That's like 3 to 6 quarts a day, depending on your activity. 3 on the low end, 6 if you're an athlete, sweating a lot. So, okay, all right, so let's get into here's what to eat. Dark leafy greens. You got arugula, beets, beet greens, kale, the tops of the beets, right? Red bell pepper and berries, that's vitamin C and flavonoids. Of course, my favorite, pumpkin seeds. Throw some sunflower seeds in there too, by the sunflower seeds. Pumpkin seeds and sunflower seeds, zinc and magnesium for your prostate. Citrus water, nettle tea, dandelion root, those are natural lymph cleansers. So you can get that in there, rotate those around, rotate it, fill it out. And, you know, cut back on your fried foods and sugar. They congest your lymph, right? Let me see, you got some herbs, you got some red clover. That's a classic lymphatic cleanser. I said nettle root, right? Nettle root leaf. That supports and soothes the prostate tissue. Turmeric, I forgot about turmeric. Turmeric and ginger, that helps to fight and neutralize, I hate saying fight, helps to neutralize chronic inflammation. So take them all as a tea or tincture or capsule, and your lymphatic system is, remember, is your prostate's drainage system. So think about how the sewers, they gotta get cleaned out, otherwise, or a septic tank. Septic tanks got to get cleaned out. So you need to do this daily for your body, for your prostate, for your health. Let's get healthy.
Quickly jump to the food. Again, your nutrition is very, very important. So you want to cut out the fatty foods, replace them with healthy foods. Avocado, pumpkin seeds, flax seeds, cashews, olive oil, salmon. Again, omega-3, fiber. You want to increase your fiber intake as much as possible. Berries, peaches, tomatoes is known to reduce enlarged prostate. There's research and doctors that have shared that. Again, you want to cut out, as he mentioned, all the inflammatory food that's contributing to the enlarged prostate, and eat more fruits and vegetables. Alkaline, eat a lot of greens. Turmeric, thyme, garlic, cinnamon is also anti-inflammatory. Broccoli, celery, mustard greens, kale, basil, the flaxseed, the almond. All of these are known to alkalize the body. Again, chlorophyll. Remember, I talk about chlorophyll. Please, greens, and more greens. It acts like a blood cleanser, blood builder, immune system booster, oxygen booster. It just helps to cleanse your body. So it's important that you are eating as much greens as possible. I share this nutrition guide a lot. Which consists of fruits, vegetable, nuts, grains, seeds, teas, and spices that are anti-inflammatory. I eat from this list every single week, and you want to make sure that you, have taken in the right amount of zinc, because zinc is important for testosterone. So you get zinc from lentils, chickpeas, kidney beans, tofu, quinoa, collard greens, avocado, kiwi, broccoli, cashews, oregano leaf, basil, eggs. So there's a lot of sources that you get it from. You just got to consume more of it as you get older so that your body can absorb these nutrients. to help to keep you healthy and your immune and boost your immune system. All right, so we are going to jump to our presentation so we can finish out our show. I ask, please, if you can, watch this part because it's about the prostate, how it functions, how important it is, because our men, unfortunately, if the statistics are true, that master herbalist brother Patrick Dells mentions in his presentation that our men are not making it past 52 or being diagnosed later, and also mentioned earlier in the video by the doctors is that prostate cancer tends to increase for African American men and Caribbean men in their 50s. You can try and catch it early in your 40s. So hopefully this will be, enough information to at least guide you so that when you do reach that age, if you're not there yet, or if you are, these are steps and things that there are things that you can do, as well as educate yourself on the prostate. So let's go to the video.
Very, very significant presentation on prostate cancer and BPH, benign prostatic hyperplasia in us men, impotence and ED, called bad circulation in the penis. We're going to more concentrate on prostate cancer because, brother, am I lying? If I lie, tell me I'm lying, right? We had a gentleman coming with prostate cancer, and he had a catheter in his penis, yeah? So usually if we have an enlarged prostate gland, the prostate gland goes right under the urethra and it squeezes the urethra that carries the urine, and then we can't urinate as men. Because as we get older, the prostate grows also, unless we can take care of the prostate gland, yeah? So the brother came in, older gentleman, prostate cancer, and he came back to the right brother? Yes. Put him on a put. He's amazed. And we sending him back to his urologist because, as I said before, we have to work with a urologist. When he goes back to the urologist, he's going to take all that catheter in his penis because he says he's peeing like crazy now. Because now we are shrinking his prostate gland. Yeah? So tonight what we're going to do, we're going to teach brothers, yeah, how to prevent prostate enlargement and prevent prostate cancer, but also how to prevent your prostate gland from becoming enlarged. So you're going to have to put a catheter in your penis, can't pee. There's no sex when you put a catheter in there. Penis, come on. You understand? Warning you all men. So we're going to talk about from the age of 17, 18, when testosterone is at peak, and at 40, 50, when testosterone is tapering down. How you can get your sex life back. 70, 80, 90, and still banging, you know what I'm saying? So let's go to the border, we're going to talk about that. But first we're going to give thanks and praise to the Most High Jehovah God, Yahweh. Yeah? Ultimate healer of all things. See my son right here? I warning him. That's my big son. I warning him. I tell him too much sex is no good. Yeah? I warning him from young. From now. I tell him all, you can't kill the pussy cat. That's my son right there. All right. Wonderful. So we're going to talk about prostate cancer and BPA prevention and treatment. Yeah? Now, BPH is benign prostatic hyperplasia in the medical term, meaning that the prostate is enlarged. Yeah? As I said before, your prostate grows as we get older if we do not take care of the prostate gland, because a lot of black men doesn't know how. And we find that lots of our young brothers in the 40s and in the early 50s is now coming down with prostate cancer, or prostate enlargement, or prostatitis, or even troubles in the urinary system, yeah? So although the prostate is not part of the urinary system, because of where it is located, it can cause us men to have troubles in that area. All right, and that's the reason why when you have BPH, benign prostatic hyperplasia, and the prostate become enlarged, it squeezes the urethra so we can't urinate. Yeah? Wonderful. So we're going to get into BPH, prostate cancer, impotence, ED, your penis can't get hard, blood can't flow. Right. Now, We said before, and we want to say it again. We're going to come back and we're going to try to educate our men. Our men. And I want to concentrate on black men. Because our brothers is dying from prostate cancer at 45. Our brothers in the black community, because we are ignorant of the fact, not knowing how the prostate works, we are dying from prostate cancer in the 50s. Our brothers. And then the man in the white coat, he removes your prostate gland. You see? And then he removes it, and then he say your cancer is, you're cancer free. But after 2 years, although he removed this gland, your cancer come back. Because he only removed the part of the body that had the cancer. So we are trying to educate our young brothers who's growing up. So you all don't make the same mistake that lots of us made. All right, so we're trying to teach you all. All right, now, this is a normal prostate. And this is a cancerous prostate. This is where the prostate is located, under the urethra. And the urethra carries the urine. So come over here, sir. Come over here, closer now. See, right here. So this part of the anus is where the doctor will put his fingers, and he can feel the prostate right here. So this part of the intestines correspond to the prostate, and this part of the intestine corresponds to the woman's uterus and the genital areas. Yeah. Now, when a man goes to the bathroom and his feet is on the ground, this part of the colon called the sigmoid colon squeeze a lot, and when it squeezes, lots of the waste matter get into the prostate gland, or you get hemorrhoids too, or polyps in the sigmoid colon. Yeah. So what we advise lots of men to do is when you're going to sit on the toilet bowl, you elevate your feet, and when you elevate your feet, this part of the colon relaxes, the sigmoid colon that is, and the waste matter comes out without seeping into the prostate. Although they have capsules, the waste matter can stick out in the capsule and cause damage to the prostate long term. One, cholesterol. High cholesterol also can seep into the prostate gland and cause you to have prostate troubles, and you might think because you have a high PSA that you have cancer in the prostate gland, but because there is lots of cholesterol clogging up the prostate gland, causing your PSA to rise. Yeah? Over here, sunshine. Back over here. All right? So, we know now that because the prostate gland is located under the urethra, yeah, if the prostate becomes enlarged, it can squeeze the urethra, and we as men cannot go to the bathroom to urinate. Yeah? Long term, if we don't take care of the prostate gland, then the prostate gland becomes cancerous. And then you have what we call a compressed urethra, and then you have cancer, and you can't pee also. That's problematic for us men. Yeah? Now we're going to teach you how to keep the prostate like this and prevent it from coming like that. Yeah? All right. We did this already before, we wanted to re-educate because men ain't listening. You're all taking your prostate gland. You know what I mean? In 1999, there was an estimated 179,300 cases with 37,000 deaths in men in America alone. And in 2023, 24 is getting worse because more men, over 235,000 men or more now, is coming down with prostate cancer, prostate enlargement. And the numbers are dying from prostate cancer is even more. Yeah? So we have to educate our men on how they can take care of the prostate gland. Yeah? Prostate cancer. We just said before that because the prostate is located under the urethra that carries the urine, if it becomes enlarged, it can cause us to have trouble in the prostate gland in terms of urination. And the doctor do not know how to shrink your prostate gland. We're going to teach you how to do that because he do not know how to shrink your prostate gland. He put what? He put a catheter in your penis. Yeah, because you can't pee. Because the prostate is enlarged. See? It compressed to the urethra. See? Yeah, now, when you put a catheter in your penis, you can get retention of urine. And you can also get infection. Because not all the urine is coming out. Because you may have a catheter in there. So lots of men who have the catheter in the penis, they also have to take antibiotics because they cannot remove a lot of the urine. That's number one. Number two, because the catheter is there, very painful though, you start to get lots of pain and lots of infection too. Yeah? Because there is something in the penis which not supposed to be there. Number three, he, the doctor, can do a TURP. A TURP means that you take an instrument and he put it into the penis hole and he goes up with the camera and he scrapes the prostate gland. If you have BPH, benign prostatic hyperplasia, yeah, it makes you pee, but 2 years it comes back because you go back doing the same thing again. Yeah? So that's when you have troubles with BPH, benign prostatic hyperplasia. Prostate cancer. Now, if the cancer is in one lobe, yeah, they stage you. They give you what we call a Gleason score in the medical system. If the cancer is in 2 capsules, the Gleason score rises. We're going to teach you what they are in a little while. Yeah? So you have 1 capsule, 2 capsules. So this cancer here is in 2 capsules, making it more aggressive and come out of the prostate gland to go into circulation, to go into the man's bones, in his spine, in his lung, in his lymph system, and then the man dies from prostate cancer. Yeah? Long term. And lots of, I think it's Hulk. That's what he died from. Bill Baxter, he died from prostate cancer. Lots of actors and even another big actor again, he died from prostate cancer too. And they had a lot of money, so money can't save you. Yeah, you have to take care of the prostate gland as a man. Women, teach a man. Right now, risk factors. Risk factors, age. So the older you get, is the more the prostate become enlarged and become prone to becoming cancerous. Yeah, but that doesn't necessarily mean when you get older you're gonna have prostate troubles though. See? Unless you're not taking care of the prostate when you were younger. It catches up with you when you get older. Yeah? Young brothers, start listening. Race. Black men, African American men from African descent have more prostate cancer than any other man, any other race. Facts. Do the research. Studies. The man who's in Africa, prostate cancer is unheard of. But when the African migrate to the West, and he incorporated the Western man diet, he started getting prostate cancer faster. Yeah? Family history and a genetic predisposition. Meaning that if your father had it, your uncle had it, your grandfather had it, and you follow the same pattern, you can get prostate cancer eventually. Yeah? And when you lose the prostate gland, you become like Lazarus, your penis dead. You're going to look at the woman and just start scratching your goddamn head. You can't have no sex no more. Don't remove it. Save it. Reproductive factors, meaning that you have STDs. If you have gonorrhea, syphilis, they can cause you, the individual, to get prostate cancer faster, and dietary factors like fat, lots of fattening foods, kill the prostate gland. Cholesterol, for instance, will clog up the prostate gland eventually. So those are risk factors, yeah, of prostate cancer. Now the doctor was doing a PSA called a prostatic specific antigen test, yeah. DRE means a direct rectal examination, meaning come over here, son. You're going to put his hand in your rectum, DRE, and he feels the prostate. If the prostate is hard, he will say, you look at you got prostate cancer, let's do a PSA, and we're going to give you the number of the PSA, proving that you don't or you do have cancer. The DRE, right here, feels the prostate. He say, prostate is too soft, it's too hard. If it's too hard, it's no good. It's no good. Now, they can take an ultrasound of the abdomen and pick up the size of the prostate gland. Now, if the prostate gland is supposed to be, 4.5 centimeters? If it's 6 centimeters, the doctor will say to you, your prostate is enlarged because now the centimeters is higher than normal. Okay, come over here, Santa. Wonderful. We just talked about truss a while ago. The truss where they put that instrument in the penis hole and they start scraping the prostate gland, and they will cause it to urinate, but after a couple of years they come back again. Right? It's called truss or transrectal ultrasonography. Yeah. Now, when you go to a urologist and he starts looking at your PSA. He starts to grade you. So you have 1 plus 1 is 2, 2 plus 2 is 4, 4 plus 4 is 8. That's problematic. He called it a Gleason score. Yeah? So when you have a grade 1 to 5 Gleason score, the doctor knows that you are well differentiated, 1 well differentiated to 5 undifferentiated prostate cells. Gleason score 2, 1 plus 1. If you have the score 5.5 is 10, he knows for a fact that the cancer is what? Is in what? 2 capsules. And the cancer is coming out of the capsule now. So your grade is higher. They call it the Gleason score in the medical system. Yeah? Black men have to learn about these things because you're dying from prostate cancer in the 40s. Yeah? And when you have prostate cancer in the 40s, it is very aggressive. It's not like the older men who have it in the 80s, and the doctor will say, you know what, you're going to die from a heart attack, because the older man, when he has prostate cancer, the cancer is slow moving. So he can die from a heart attack than prostate cancer at the age of 80. Don't forget that. The younger you are, the more aggressive the cancer is, okay? Wonderful. We go again. So we're going to score. Gleason score, 2 plus 2 is not bad. 1 plus 1 is not bad. See, 5 plus 5, boom, that's it. Cancer coming out of the capsules. Yeah? Now, when he starts to stage you now, he starts looking at your PSA. We're going to teach you that now. Teach about the PSA also. A1 tumor have a low Gleason score, meaning that it is not in the end of the capsule of the prostate, but is intact. Yeah? A2, the tumor presents a higher Gleason score and possesses capacity for metastasis moving onto the prostate gland. See? So if you have a Gleason score of A2, we know for a fact now that the cancer is coming out of the prostate gland. Stage B, the tumor is confined to one lobe of the prostate gland. See? B2, the tumor involves both lobes of the prostate gland. The tumor is involved in what? Both lobes of the prostate gland. 2 lobes. Yeah? Not 1 lobe now. See? So it's more aggressive now because it's in 2 lobes. Don't let it get into the prostate eventually. Yeah? And all, period. Yeah? B2, the tumor involves both lobes of the prostate gland, and now it's looking to come into the prostate. Yeah? Stage C. C1, evidence of extension. Meaning that the prostate is enlarged, extending, and because it is under the urethra, the cancer is now eating away the prostate gland, and it is extending, coming out. C2, the tumor producing bladder obstruction now because your prostate is so enlarged, and the cancer is growing, so it's causing you to have trouble in the bladder. You can't go to the bathroom. He had to put a catheter in your penis. You can't pee. And the woman going to look, and she said, oh my goodness, I can't have no sex tonight because there's a catheter in my man's penis. And to them, you have to keep the catheter in there for years. But we're going to show you how to shrink the prostate gland. Stage D, metastatic prostate cancer, meaning that now D1, the cancer is in lymph node involvement, and 2, distant metastatic involvement. It is in your bones, it is in your lung, it is in your liver. And that's when you start to have more troubles now, because once a cancer gets into an organ and disrupt the function of that organ, then you are in problems long term. Yeah? So we have to make sure that we don't get prostate cancer. Or if you do have it, like we treated a few brothers who have it, and they're doing pretty well. Like the gentleman today came back, he's doing good. We're going to send him back to the urologist and take out the catheter in his penis. And we have another brother T. You know who you are. Hope you're on the live. He's doing pretty good also. Yeah? With his prostate. Yeah? And his kidney too. Yeah? Now we're going to talk about these herbs in a while. Saw palmetto, white sage, stinging nettle, coranzonia, corn silk, hydrangea, zinc supplements, cleavers. We're going to talk about them. What they do. Yeah? Now, in studies, vitamin E in prostate cancer treatment has shown to inhibit cancer growth in human cells as well as cell culture studies, not Patrick Debs. MCP, modified citrus pectin, from what? Oranges, tangerines, grapefruit skin, lemons, key limes. It prevents the spread of prostate cancer by inhibiting what? The binding ability of what? Cancer cells. They don't teach you that. Because all they know is chemotherapy and radiation and surgery. See, but I'm teaching you now. Black men. Yeah? So if you want to help vitamin E with the prostate gland, vitamin E is very significant. 800 IU per day. Dry E. Not the gel E, dry E. D-R-I. Yeah? Aged garlic, zinc, specs. We have specs, right? Put out specs for them in a little while. So I learned specs because now specs, they have to go on the ground. Because specs been fixing prostate cancer. And they run the doctor who was doing specs. But you know what? I say, you know what? I'm a follow the doctor now. When I started putting some herbs together for specs, I have it as specs. So you take specs with all the things you're going to teach you what to do, you're going to fix your prostate cancer. You're going to take out your prostate gland. Yeah? B-complex, men's multivitamin from what? Over here. Men's multivitamin from ambrosia. See it here? Where it is, yeah? With saw palmetto. To fix the prostate cancer. Hold the immune. Let's go over here. Now, let's talk about nettle root and saw palmetto. What do they do, Patrick? Nettle root, not nettle seed, not nettle leaf, nettle root and saw palmetto. They act as 5-alpha reductase inhibitors. They act as 5-alpha reductase inhibitors. What is 5-alpha reductase, Patrick? 5-alpha reductase is an enzyme. Yeah? So that enzyme helps to increase dihydrotestosterone, which is the culprit of us men getting prostate cancer. Look it up for me. Dihydrotestosterone. Saw palmetto and nettle root is very significant because they act as a 5-alpha reductase inhibitor, but they can also inhibit prolactin and aromatase, phospholipase A2, and estrogen receptors in men's prostate tissue, preventing you, the man, from getting prostate cancer. Or if you do have it, it helps to reduce the 5-alpha reductase inhibitors. See? Because once you cannot inhibit 5-alpha reductase, you start to get a high level of what? Hydrotestosterone. It's just like when you have heart disease. Yeah? You have to get rid of that enzyme or that amino acid. Yeah? Because if that amino acid become high, you get trouble with heart disease. If the 5-alpha reductase is not inhibited, then the hydrotestosterone will rise and put us men at risk of getting prostate cancer long term, especially when you pass the age of 30. Yeah? Look it up. Educate yourself. When these two herbs act as 5-alpha reductase inhibitors, when they also inhibit prolactin, yeah, aromatase, and phospholipase, and when they inhibit the estrogen receptors in our men, in the men's prostate tissue, it reduces inflammation, number one. You don't get BPH, number one. It reduces inflammation. It inhibits the growth of the prostate tissue while reducing benign prostatic hyperplasia symptoms. Prostate enlargement. So when you take these herbs, it reduces the inflammation and it also inhibits the growth of prostate tissues while reducing the enlargement of the prostate gland. They don't teach you that. Next one is called stone root. Let me give you a few of them, you know. It's called Collinsonia. This herb acts with gravel roots. If you have kidney stones, it helps to remove kidney stones because it deals with what you call vascular integrity in the man's prostate tissue. But it also reduces congestion in the prostate gland while inhibiting dribbling. When you go to the bathroom, you can't pee, you're going to dribble, small shit coming out, small little pee coming out. It stops that. And it also prevents prostate inflammation because it deals with what? Vascular integrity. Yeah? It keeps the veins strong. So it's also good for men who are suffering from ED, erectile dysfunction. White sage, not red sage, not black sage. White sage shrinks the prostate gland, preventing inflammation. White sage, I'm going to say it again. White sage shrinks the prostate gland. We don't give you Hytrin. We don't give you Lupron. We don't give you Proscar. We don't give you those because you got to take them for the rest of your life. You know what I'm saying? We give you white sage. If you have benign prostatic hyperplasia, because it shrinks the prostate gland. Yeah? Preventing inflammation of the prostate. Yeah? While we are using the nettle root and the sulfur metal to act as 5-alpha reductase inhibitors, and also acting as inhibitors of prolactin aromatase and phospholipase and estrogen receptors in the tissues of the man's prostate gland. That's what they do. But because a lot of our men is not educated, you all go and you all tell the man, tell you all you have prostate cancer, you all go, well, I got to take on the prostate because you tell me I have prostate cancer, but your cancer come back after you remove it. And your sex life gone. And then another man have to come into your cane field. Eat your cane. Yeah? At 45 years old, you're crazy. Other herbs that is very significant for the prostate gland, Magadon woman for your old man, pipwissa, corn silk, pygeon bark, couch grass, cleavers, butchu leaves, hydrangea. Those are the herbs that can be used to prevent benign prostatic hyperplasia, enlargement of the prostate gland. Or if you have prostate cancer, we can give you these herbs to work to help to keep the prostate healthy. Yeah?
All right. Thank you all so much for, am I still on mute? No. Thank you all so much for watching that video. I hope that you are able to share today's live with someone who can benefit from the knowledge that was shared by Brother Patrick Delvies, because again, so many of the men in our community do not have this information available to them. So I hope that you share this live about prostate health and prostate cancer, enlarged prostate. Again, this is vital information. Again, this is educational and informational purposes only. This isn't meant to replace any treatment or diagnosis. Do your own research, consult with your physician, but it's important that we, break down, these health issues, get down to the root cause and how we can use some of the natural foods that's available to us to fight the inflammation or reduce the inflammation, not only in prostate health, but also breast health, also help with diabetes, also help with high blood pressure. All of these things are interconnected because our bodies function the same. Our genetics might be different, but our bodies, function the same, where all of the vital organs, everything that we share, including our blood, is the same. So please take care of yourselves. start changing your diet and your nutrition. Be in tune with your body. Listen to your body. Listen to what it's telling you. But also be an advocate for yourself in terms of what you can do naturally to reduce inflammation in your body that is, usually the precursor to many of these diseases. So if you've been eating the same food for 20, 30, 40 years, please consider changing it. If you haven't done a cleanse, please consider doing a cleanse, because that food some of it stays in your body. If those, you eat a lot of food that's canned food, there's a lot of high fructose corn syrup, dextrin, chemicals that we can't even pronounce. Some of those, stay in your body. So please consider cleansing with natural fruits, vegetables. Movement is important. Exercise is important. The lymphatic, manual lymphatic drainage, the massages to get rid of toxins and waste and foreign objects in your body. Just do your part to take care of yourself. You have to touch your body to heal it. You can't just rely on a medicine, popping it in your mouth and then going about your business and think that that's a cure. It's not. That's the reality. So let's do better, take care of ourselves one day at a time, loving ourselves one day at a time by touching it to help it to heal, changing our diets and nutrition, making ourselves a priority so that we can live longer and healthier lives. All right. And with that, we will end today's show. Thank you for joining today's episode of Healthy Corner. Ayo.